Hello, I'm Josh Evers, and I passed my NCLEX over 10 years ago. Could I still pass it today? But I wouldn't bet on it. Let's find out. Real quick before we start, I just want to thank the sponsor for this video, Stink Balm Odor Blocker. Nurses, healthcare workers, our jobs stink. Hospitals stink, nursing homes stink, people's houses can stink. People stink. I stink. Sometimes. Stink Balm is a discreet, effective way to help us get through our jobs a little bit easier. Go to stinkbalmodoorblocker.com. Try it a couple cents. Use code JOSH20. You get 20% off. If you don't like it, there's a money back guarantee, but you will. It smells great. Thanks, Stink Balm. Okay, let's go ahead and get started. Let's see if I can still pass the NCLEX after 10 years. It's going to be embarrassing, probably. Okay, question 1. Nurse is caring for a client who has been newly diagnosed with type 1 diabetes. Which of the following findings should the nurse recognize as a sign of hypoglycemia? A. Fruity breath odor. No, that's hyper. B. Kussmaul respirations. Nope, that's hyper. C. Tremor diaphoresis. Okay, yeah. Shaking and sweaty. We will go with number C. Correct. Tremors and diaphoresis. Rationale is tremors and diaphoresis or sweating are classic signs of hypoglycemia, along with irritability, confusion, tachycardia, hunger, and weakness. The fruity breath and the Kussmaul respirations are hyperglycemia or DKA. All right. Hopefully they're all that easy. Okay, number 2. A client with heart failure is receiving furosemide. Which of the following findings is most important for the nurse to report to the provider? A serum potassium of 3.2. Okay. Weight loss of 1.5 in 24 hours. No, that's what we're going for. Blood pressure 138/86. Nope, that's pretty good. Mine's probably higher right now. Or a presence of +1 pitting edema in the ankles. No, that's probably gotten better actually. If they're in there getting Lasix. Okay, so it's A. It's the serum potassium of 3.2. They're losing potassium through the diuretics. Correct. Furosemide is a loop diuretic, causes potassium loss. Yep. Blah, 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 blah. Killing it. Killing it. Okay. Number 3. A nurse is preparing to administer an intramuscular injection to a 4-month-old infant. I don't like the kid stuff or the baby stuff. Never was good at that. Okay. Which of the following is the appropriate site for the injection? Ventrogluteal, deltoid. I know it's not deltoid. So A is ventrogluteal. B, deltoid is not deltoid. C, dorsogluteal. And D is vastus lateralis. What is vastus lateralis? I don't even know what that is. I mean, I know it's a muscle. It's either the thigh or the butt, but I'm going to go C, dorsogluteal. No, that's incorrect. Okay, it was the vastus lateralis. What is that? Hold on just a second. Oh, that's the thigh. Okay. Well, that's embarrassing. Number 4, let's see if we can redeem ourselves here. Number 4. A nurse is caring for a client who has pneumonia and is receiving IV antibiotics. Which of the following assessments is the priority? A, the temperature. B, white blood cell count. C, the breath sounds. D, sputum culture results. Temperature's shooting out at me just because we're looking for, we don't want sepsis. For the record, I haven't worked in a hospital in over 3 years. I do home health, and that's no excuse. White blood cell count is going to be elevated. The breath sounds. I mean, they've already got an infection. Is it the breath sounds? I'm thinking breath sound. Well, if they've already got pneumonia, their breath sounds are not going to be the best anyway. I'm going to go A, temperature. That way we know if, maybe the antibiotics aren't working. Dang. Okay, it's breath sounds. The rationale is in a patient with pneumonia, airway, breathing, taking priority, and always think ABC, airway, breathing, circulation. Okay, you got me. All right. We're missing some. Let's get back on track here. Number 5. A nurse is caring for a client post-thyroidectomy. Which of the following findings requires immediate intervention? Okay, I should know this one. A hoarse voice is expected. A is a hoarse voice. B is neck pain at the incision site. No, that should be normal. C, difficulty swallowing. That's expected, I believe. And D, tingling around the mouth and the fingertips. Okay, it's D, but I'm going to try to figure out why. It is D because in surgery, they cut something that wasn't supposed to be cut. I'm sure a lot of you are yelling what the answer is right now. This is a good question. I know it's tingling around the mouth and fingertips only because all the other answers are wrong. So yeah, something was damaged during surgery that wasn't supposed to be. Well, yeah. Okay, come on. Just give it to me. Yeah, that's correct. D. Okay. But let's see why. The rationale. It is the tingling around the mouth and the fingertips after the thyroidectomy can indicate hypocalcemia, often due to accidental removal or damage of the parathyroid glands during surgery. And this can lead to tetany, a potentially life-threatening condition if untreated. Okay. And all the other stuff is expected. Okay. We got it. One way or another. Okay. Question 6. Nurse is caring for a client receiving a blood transfusion. 15 minutes after the transfusion starts, the client reports chills, back pain, feeling of anxiety. What is the priority nursing action? Okay, so we know what this is. They're having a allergic reaction. Okay, so A, notify the provider. B, stop the transfusion. Or C, assess the vital signs. Or D, administer diphenhydramine, which is Benadryl. B, stop the transfusion. Got it. Another one. We got it. This is easier than NCLEX, and the NCLEX was not that hard, to be honest. Okay, stop the transfusion. Rationale: the signs of a hemolytic transfusion reaction, which can lead to can be life-threatening. The very first and most important action to stop the transfusion immediately to prevent further exposure to the antigen. Good job. We got it. Okay. 7. A client with COPD is receiving oxygen via nasal cannula at 5 liters per minute. The client becomes increasingly drowsy and difficult to arouse. What should the nurse do first? Okay. I'm going back and okay, let's look at the answers. A, increase oxygen flow to 6 liters. B, assess client's respiratory rate. C, place the client in a high Fowler's position. D, decrease the oxygen flow rate. Okay, so we're not going to change the oxygen flow because we don't know what the O2 is yet. We don't know what their oxygen level is. I am guessing right now that this patient is getting too much oxygen because they're a COPD patient. So we're probably going to lower the oxygen. We don't know. You never want to have your COPD patient at like 100% or anything. So the first thing that we're going to do, help them breathe better. We're going to put them in the high Fowler's position. Assess their respiratory rate. So C, we're going to put them up so they can breathe. So we're making sure that they can breathe better, the airway. ABC, right? What? Okay, so I feel like we got cheated on this one. B, assess the client's respiratory rate. When COPD patient becomes drowsy, especially on oxygen, the nurse should first assess respiratory status, rate, depth, effort, and level of consciousness. This helps determine if client is experiencing CO2 retention, which can occur when this is what I knew was happening. Getting too much oxygen. It's a crazy thing. Okay, so high Fowler's is helpful after the assessment. I don't know. Did I get that one wrong? Really? Did I get that one wrong? Maybe I got that one right. Maybe ChatGPT don't know what they're talking about. Okay, number 8. Let's redeem ourselves here. A nurse is caring for a client with a pressure injury on the heel that has full thickness tissue loss, exposure or exposed bone, and slough. How should the nurse stage this ulcer? That's a stage 4. Okay, so A is stage 2, B is stage 3, C is stage 4, D is unstageable. It is stage 4 because of the full thickness and the exposed bone. Yes, that is correct. Stage 4 pressure injury involves full thickness skin and tissue loss with exposed bone, tendon, or muscle. It may also include slough or eschar, but the key defining feature is that deep tissue is exposed. Okay. I think we all knew that. These are pretty easy questions. Maybe this is helping somebody out early on, but the NCLEX is going to be a little bit tougher than this. Okay, question number 9. Client is taking warfarin for atrial fibrillation. Which of the following client statements indicates a need for further teaching? A, I'll use an electric razor when shaving. Nope, that's good. B, I'll take ibuprofen for headaches. Uh-oh. C, I wear medical alert bracelet. Good for you, Ronald. I'll just call him Ron. And D, I have my INR checked regularly. What does regularly mean? Anyway, the answer is B. Can't take ibuprofen because of risk for stomach ulcers. Correct. B. I take ibuprofen for headaches. Clients on warfarin should avoid NSAIDs like ibuprofen because of the increased risk of bleeding. Tylenol is a safer option for mild pain relief and less contraindicated. Good job, guys. We got another one. And number 10. So what did we miss? Like 3? Number 10. A nurse is reviewing the lab results of a client who has acute kidney injury. Which of the following results is most concerning? Creatinine 2.1. Potassium is 6.3. Yep, that's the one. BUN is 35 or hemoglobin is 10.2. Okay. We are going to assume that their kidney function is going to be off, but that 6.3 potassium is too high, and they have risk for cardiac-related stuff. Correct. Potassium 6.3. Rationale is hyperkalemia is most immediate threat. Acute kidney injury. A potassium level of 6.3 is dangerously high, cause life-threatening cardiac dysrhythmias, including ventricular fibrillation and cardiac arrest. Creatinine 2.1, BUN 35 are elevated, but not as acutely dangerous. And hemoglobin 10.2 is low, but not immediately critical. Yeah. Okay, 7 out of 10, that's not bad, but let's be honest, those were not very tough questions. Those are pretty, if you are a nurse, those are pretty common knowledge, or maybe it's just because I've been a nurse for a while. I don't know. But to me, that didn't seem like real tough NCLEX questions. What did I do for NCLEX? I went to the University of Oklahoma and we used ATI, and ATI was tough. But I guess it really helped. At the end, it gave me like a 97% chance of passing the NCLEX first try. And I did pass NCLEX first try. I was, oh my goodness, we had scrap paper and a pencil, and it was on the computer, but we had that scrap paper and I was dripping sweat on it. I was so nervous. But I finished at 75. So if you don't know how NCLEX works, at the 75 question mark, if you're doing really good, the test shuts off. If you're doing really bad, the test shuts off. And I shut off at 75. So I guess I was doing good because I did pass it. So I don't know if it's still like this, but back whenever I took the NCLEX, you have to wait a little while to get the results to see if you pass it. And you're just like so nervous. So there was a trick you could do. You could go online and act like you were signing up for the test again. And if it would let you sign up, then you passed and you'd have to pay the fee again, like $250. But if you passed it, then it wouldn't let you sign up and you could be like, yay. And I did that and it came back and it said, yay. So, and honestly, the NCLEX was one of the easiest tests I took during nursing school. I've heard they really kind of like bumped it up, but I went to a good school and it was, they really helped out a lot. But now I hear that half the test is like check all that apply, or, choose all that apply, whatever it's called. And I didn't have very many of those questions. Also didn't get very many baby questions, which are very hard. Anyway, I hope you guys enjoyed this. It wasn't as embarrassing as I thought. The test was too easy. But anyway, please don't forget to subscribe, like the videos, comment down there. And if you want to, give me a story. I'm telling funny stories, scary stories, ghost stories, whatever you got. Like, I love scary hospital stories. My next video is going to be a deal where I tell 3 scary stories. 2 of them be true and 1 of them was made up by AI or something. I'm still putting it together. So if you want to, send me an email, send me your stories, josheversnurse@gmail.com. Thank you all so much. I really appreciate you. Thank you, Stink Balm, for sponsoring the video. Thank you all. I love you. Have a great shift. Good night.